Hello, CHW Hub. It's Nurse Sarah. Today we're going to be talking about transmission-based precautions and personal protective equipment. It's really important that everyone within the hub be trained on this, and you will be required to complete a post-test after watching this video, um, especially if you're working in the emergency department or in the cancer center. This is going to be really vital information for you to know. At the end of this training, you're going to be able to locate the rush transmission based precautions policy within Link, identify appropriate PPE for each category of transmission based precaution, identify certain illnesses that fall into the transmission based precaution categories, and be able to appropriately don, which is to put on, and doff, which is to take off or remove personal protective equipment. There are 5 categories of transmission based precautions that we commonly encounter at Rush, and each category has its own special requirements in terms of PPE. The 5 categories are droplet, contact, contact plus, airborne, and special precautions. If you want to know whether a patient is on precautions, just check their room door for a sign. You can also check their chart to see if precautions are noted in their chart, but sometimes this can be delayed. It can take a while. So checking for the sign first is best. And if something is ever unclear, ask the nurse, the charge nurse, nursing assistant. They'll all be able to guide you. And you can always find Rush's policies in the Link portal, and I'm going to show you how to do that at the end of the presentation. In addition to the 5 categories of transmission-based precautions, you may hear people on the unit refer to standard precautions. And this refers to the safety measures taken with every patient, regardless of diagnosis. For example, with any patient, regardless of status, you're going to clean in, clean out, which means that you wash your hands with foam sanitizer or soap and water before entering or leaving the patient's room. Most of these other precautions only apply to patient care, so they don't necessarily apply to your role, but they are here for you to review just in case you're curious or want to know. Droplet precautions are typically initiated for respiratory illnesses that are spread by sneezing, coughing, or talking, or during aerosolizing procedures like suctioning. Some of these conditions include pneumonia, influenza, whooping cough, and bacterial meningitis, which you may note is not a respiratory illness. For droplet precautions, you need to wear a surgical mask that covers your mouth and nose anytime that you're in the patient's room. And then you need to change to a clean mask after leaving the room. As always, you should clean your hands before entering and leaving the patient's room. Contact precautions are initiated when patients have an infection that spreads through direct or indirect contact, like in the case of a rotavirus, norovirus, or MRSA. When a patient is on contact, wash your hands, then put on a gown, surgical mask, and gloves before entering the patient's room. The gown must be tied securely. Before leaving the patient's room, you must remove all PPE and discard it in the trash can. Personal protective equipment must be put on and taken off in a specific order, and we're going to go over that in the last portion of the presentation. And then, of course, clean your hands before leaving the patient's room. Contact Plus is specifically for Clostridium difficile or C. diff. It is essentially just like contact precautions, except that you must wash your hands with soap and water for at least 20 seconds upon entering and leaving the room. C. diff is an incredibly contagious and truly awful gastrointestinal illness that you do not want, and you do not want to spread it to others in the hospital. So, for that reason, be sure to adhere to this protocol. Airborne precautions are used anytime someone has an illness that can linger in the air for long periods of time after the patient coughs, sneezes, or talks, or during aerosolizing procedures like we talked about before. Some airborne diseases include tuberculosis, measles, and SARS viruses. Now, SARS viruses include COVID 19, but COVID 19 has its own special type of precaution. All staff entering the room of a patient with airborne precautions will need to clean their hands before entering the patient's room and put on either an N95 mask or a PAPR mask. You will use an N95 at Rush. After leaving the patient's room, remove your N95 and clean your hands. You can use your N95 as needed for the rest of your shift. It is important to note that to use an N95 mask at Rush, you have to be fit tested. So make sure that you do that. You can be tested at Employee Health on the fourth floor of the Atrium building, and you can just walk in for testing anytime during their operating hours as long as you have your Rush ID with you. Special precautions are used for people with suspected or confirmed COVID 19. In terms of PPE use, you will defer to the sign on the patient's room door for what PPE is required. Usually, the PPE will include a gown, gloves, an N95 mask, and sometimes eye protection in the form of a shield. Again, if you aren't sure about what is appropriate, ask someone on staff. The nurses and nursing assistants will be able to guide you. And now we're going to talk about donning and doffing PPE. As I said before, donning means to put on, and doff means to take off. As silly as it may sound, there is actually a correct sequence for putting on and removing PPE, and all employees at Rush, regardless of status, must do this correctly. When Rush is visited by the Joint Commission or CMS, they're going to be looking at your actions along with the doctors and the nurses and all the other clinical staff. So make sure that you know how to do this appropriately. In terms of putting on PPE, the order is gown, mask, gloves. And for your purposes, you will already be wearing a mask, so you really only need to remember gown and gloves. At Rush, they have made this really easy for you because our isolation gowns have these funky finger holes. So you can't put on your gloves before you put on your gown. As in the case of special precautions, sometimes you'll also be required to wear eye protection as well, either in the form of goggles or a face shield. And if you need to do this, you'll do it third between putting on your mask and putting on your gloves. So it'll be gown, mask, eye protection, gloves. And we're also going to review the appropriate way to put on an N95 mask for when you are in the room with a patient with airborne precautions. To take off your PPE, you will remove it in this order: gloves, gown, mask. Again, if you're in a room that requires eye protection, you will remove that third between your gown and your mask. And we're going to watch a short video about donning and doffing PPE.
All right, so now we're going to talk about donning and doffing personal protective equipment, or PPE. Don means to put on, and doff means to take off. Don on, doff off. The words are already in the name, so it makes it easier to remember. So when we're all right, specific order: gown, mask, gloves. So let's go ahead and get started with our isolation gown. All right, so I have my gown, and this gown is exactly like the ones that you're going to have at Rush. To put it on, you slip your head through the hole, the arms through the sleeves, and these arms have little thumb holes that you're going to put your thumbs through. And you have to make sure that the gown is securely tied in the back. So just tie it in a little bow. I'll show you how mine is tied, like this. All right, now we're going to move on to our mask. In order to don your mask, you use the ear loops, fit the mask to your face, and make sure to secure it at the bridge of the nose. And last, we'll put on our gloves. When you're putting on your gloves, you're going to want to make sure that you're pulling the edge of the glove over the cuff of the gown, like that. I'll show you again with this hand. A little stuck in there. There we go. All right, so now you're all ready to go. Now you've come out of the patient room. It's time to take off everything. We're going to do that in a specific order too. Gloves, gown, mask. It's important to remember when you're taking your personal protective equipment off that your gloves and your gown are considered contaminated after you've been in a contact precaution or contact plus precaution room. So you need to treat them as such. So when we're taking off our glove, you'll remove the first glove by grabbing the outside with your gloved hand, taking it off and pulling it into a ball. Then you'll take one of your fingers of your opposite hand and put it under the lip of the other glove and pull it off this way and discard. In terms of taking off your gown, again, the front of your gown is contaminated. So to take this off, you'll either untie it if you can, or if you can't, you can just break the tie, pull your hands through the sleeves, press out, and you'll roll it down without touching the outside of the gown and discard. To take off your mask, you use the ear loops to push it away from your face without making contact with the outside of the mask with your hands. And that is how you don and doff personal protective equipment for a contact precaution room. Now we're going to talk about putting on an N95 mask. These are the duckbill N95 masks that we have at Rush, and there is an appropriate way to put it on. So first, I do want to make sure to remind you all that you do have to get fitted properly for an N95 mask, and you can do that in Rush Employee Health anytime during their operating hours. They're on the 4th floor atrium. So first, you're going to want to pull the strings a little bit. They're elastic, and they're a little bit tight at first. So pull, kind of loosen them up. So you're gonna start by holding the duckbill in one hand. You're gonna use the other hand to secure the top strap first. And this strap will be up toward the crown of your head. Next, you'll take the other strap, pull it over, and secure this at the base of your head. Now we're going to do just like what we did with the surgical mask, and we're going to secure it at the bridge of the nose. You can test to see if you have a secure fit by putting your hands right here by the seal and sharply exhaling outward. If you feel any air escaping, go ahead and adjust the bridge of that nose. Also, if you have glasses like me, you don't even need to use your hands. You can just sharply exhale and see if your glasses fogged up. If they did not, you have a good seal. All right, and now we're going to talk about how you take off your N95 mask. And you're just going to do the opposite of what we just did. Take the bottom, pull it over the top. Take the other, pull it over the top. And again, we're not going to come in contact with the outside of our mask. Discard. You're all set. Now you know how to don and doff your personal protective equipment and how to don and doff your N95 mask. All right, guys.
All right. And as always, remember you need to wash your hands before entering or leaving a patient's room. Thank you guys so much. Before we end the presentation, I do want to show you how to find that policy for transmission-based precaution in Rush Link. So I'm going to show you that now. All right. So okay, so let's try that again. So we're going into my apps. You'll sign in like you normally do. You're going to click on link, and that's going to open up a new window through Citrix. There we go. And then once this opens, you'll see tabs on these blue tabs on the top. Go to Policies and Procedures, Policy Tech. And it's under Infection Prevention and Control. All of these are in alphabetical order. So just go down to Infection Prevention and Control. These are also in alphabetical order. So go down to Transmission-Based Precautions. And you can read the full policy here for each type of precautions. They're all in this one document. All right. And that is everything. That's the whole training. Thank you guys so much. I hope that you have a wonderful rest of your week and stay well.